he say, she say bullshit. Oh yes, fuck being humble. I'm all in the day like some shots with no chase. Pow, wow, ow, ow. West Coast step when I'm walking it down. Let's get Nietzsche, that's so dizzy. How my mama's check.
Okay, you are watching a Perth County Spider Boy on public access, public broadcasting. This is the new public channel. Welcome to social distancing. They told us that there's a lot of concern about, putting on masks to protect yourself these days from, you guessed it, COVID-19. And that is very real. There's health concerns, and I'm here to talk about medicine of all kinds. Specifically, we got Canadian score on medical practice, the actual factual halftime. Wrong sport, I know. Gosh. I'm also mixing genres. So, let's get rid of this humbleness. Keep my mask on. Stay back, personal space. So, no more about me talking about coronavirus disease, COVID-19. And I got this from some service workers who are handing out, along with the other services they provide, they're handing out the medical tips on how to prevent the spread of this virus that is worldwide. This is a serious problem, and we need to take better care of ourselves. Both, and so throughout everything I'm talking about, I know I'm talking about poverty, and health is one of the big poverty concerns around the world. But specifically where I am, there's a lot of issues. But right now, our issues are how to care for yourself. So first, let me take this junk off, because you can't take me seriously. And I was talking about that song. Sorry, SNRK. They are. I will post a link to their songs somewhere, and as I have been. So the common signs, right? This is because I'll be talking on my channel about a lot of community issues, including health care, and these are the health tips for that. And so not just physical health, right? The physical health, but your mental or spiritual or whatever you want to call the psychological aspects of health care, because those are just as important, and we'll get to all that. So how to tell if you're getting sick. I'm sure people know if you're starting to get sick, right? Common signs of infection for COVID and a lot of other, right? So if you're sick, get checked out. Take care of your health. Common signs include fever, new cough. That's not just like coughing because you're a smoker or something irritated your airways, or you have pre-existing bronchial issues and you have a cough, right? Like there are lots of reasons for coughs. So, and all of them you need to check out. So a new cough, right? And this is like if you develop fever, new cough, shortness of breath, or difficulty breathing, or in more severe cases, infection can cause pneumonia and rarely death, but still the potential. So, if any of those symptoms, this is like a fever and a throaty lung, a breathing thing. Yeah. So, those are some of the symptoms to be on the alert for. And just as in any case, we've all gone through this with SARS and all the flu epidemics, right? And if once you get the sniffles, don't go around spreading those germs, because this is what happens, right? And these microbes, they are viral organisms, and they cross between all sorts of living organisms, not just people, and not just animals and people, but also plants and people. There is a genetic exchange between these microbes, and I don't want to bore anybody with the science, but if you feel like you have a lung issues and you're getting feverish, then see a doctor. And I I'm not going to promote the mask wearing, because that's really a precaution when you are expecting to be around people that may be infected. So perhaps when you're outside, could be a good measure, but be careful. That's all I'm saying. Because how the next on that list is how it spreads. This virus primarily spreads from person to person through coughing and sneezing, just like the common cold and flu. And your prevention steps, and this is all over the internet, people. If you want more information on coronavirus, like all of the internet is trying to put the facts that have been fact checked, and they have all these myths have been busted. And even Facebook has a link for coronavirus, and you can follow them, and it will be at the top of your feed on Facebook. And there's a lot of other platforms that are trying to get that information out there too. So keep alert, stay healthy, and here's some prevention steps. So stay at home if you're sick. That's common sense. But, some people will try to push themselves. Don't. Take care of your health. Return to work or school when you are well. If you have concerns for your health, take care of your health before going out and, doing anything, because your health matters. Wash your hands. That's the number one tip everybody says. Wash your hands. That is health sense. So stay clean. If you don't know how to stay clean, there are tons of tips. I'll try to find a couple if people really want. Avoid touching your eyes or your mouth and nose. Eyes, ears, mouth, and nose. Don't touch your face with unwashed hands. Keep your hands clean, okay? And, I was out peopling today because I had to, right? I'm in a situation where I don't have that option of just sitting in my house all the time and social distancing on the internet, which I will try to do, and I'm gonna join up with as many as I can to start doing this properly, safely, for a good community online for people to feel comfortable. Next step to prevent, cover your cough or sneeze with a tissue or your sleeve, not your hands. Keep your hands clean, because you touch stuff. We use our hands a lot. Keep them clean, keep them healthy. Health. Stay healthy. Keep your distance, which is why I'm doing that this way. And I encourage more people to use social media to do their social distancing, to remain social in these situations where you don't feel like going outside is safe. And that happens a lot. I get that. Avoid shaking hands. Wakanda salute. Yeah, don't reach, don't even prop, because that's body on body. So yeah, keep your distance. Avoid shaking hands or close contact with people who are sick. if someone's sick, I know you really want to take care of them, but you don't want to get yourself sick because you can't take care of them if you are. Next, clean and disinfect stuff. I clean and disinfect high-touch surfaces daily, use disinfectants, and follow the manufacturing instructions. And there's some numbers on here. I will post these numbers, or you can pause the screen and write them down. But keep following, and I'll get back to myself and